Today is about bunions and bunion surgery. I have two cases that I recently did. I'm going to show you the before and after bunion surgery. And a bunion, everyone calls this bump the bunion right here, but the bunion is actually caused by the first and second metatarsal creating an angle, and the angle of the metatarsal here causes the big toe to angle back this direction, thereby creating a bump here or a point. So it's not just a bony overgrowth. I always get the question of, oh, can you just shave off my bunion? Well, it's more than that. This bone needs to be shifted over in this direction. Also, the patient had a very long second metatarsal, second toe way out here, and hammer toe formation, and that surgery was done as well. Here is the after. And here it is. So the metatarsal was here, cut, shifted over here, screws to hold that in place, a little wedge in the toe to swing that straight. Fusion, a peg and a hole fusion on each of these, also shortening the toe, which was way up here before, released and brought back down. Also a release of the joint here so the toes can sit straight. So again, before and after. Here's the next case. This patient had another large bunion deformity here with the metatarsal prominent this way and the big toe drifting back, creating a large bump here, as well as a hammer toe deformity here on the second toe. Here is after. This is immediately after surgery. Again, the bone's cut, shifted, moved over, held in place with these screws, which allows the toe to become nice and straight here. Here's again fusion of the joint right here to straighten out the hammer toe, held in place with a pin. This pin will stick out of the toe and be removed here in the office at week number 4. Again, before and after. So the other question I get is, should I have bunion surgery? When do I need bunion surgery? And my answer is all the time. The bunion is only getting bigger. It is not getting smaller. The hammer toe is not going to straighten out on its own. So when there's pain on a consistent basis and you've tried some conservative care and wider shoes and that's not working, come in for a surgical consult and see what can be done, because they're not going to get smaller. You can live with a bunion pain-free. It's just not going to improve in how straight the toe is. Those online stretchers and splints to pull the toes in different directions won't work, as you can see on the x-rays, where it's actually an angular deformity of bone that's not going to be corrected by you just pulling on the toe a little bit. So if there's a question, come in, get an x-ray and just see where it looks, see how it is inside, and make sure there's not arthritis in the joint as well. Otherwise, you have a great day.